Welcome to the Non-Woke Coach podcast, the show that celebrates success without the woke. Each episode features successful people who have embraced their true nature as free, independent, exceptional beings with the capacity for well-being, rather than accepting the victimhood mindset of the woke agenda. I'm your host, Ellen McCarthy, and I'm glad you've tuned into this episode. As always, the Non-Woke Coach podcast highlights the success that comes from embracing freedom, independence, uniqueness, and empowerment. In this episode, I am particularly excited and honored to be joined by a medical pioneer whose unique approach quite literally changed my life about a decade ago when I was struggling with thyroid and hormonal issues having to do with menopause. My guest is a New York City reproductive endocrinologist with 40 plus years of experience. He's an expert in treating thyroid disorders and hormone imbalance issues in both women and men through a unique clinical approach that helps alleviate debilitating symptoms that prevent patients from leading productive, healthy, and joyful lives. Please join me in welcoming Dr. Hugh Melnick. Dr. Melnick, or Dr. M, as I know you.
Easier to pronounce.
Thank you for being here.
Oh, it's a great pleasure, Ellen.
Dr. M, so many people, including myself, struggle with thyroid issues and hormonal issues, menopausal issues. And we go to doctors and they tell us that our blood results are within normal range. And or that it's just part of aging and there's not really anything to do. But you have a passion for helping patients like me, and you have a unique approach. So could you tell us about your unique approach to helping patients?
Okay, surely. So, it's very appropriate that I'm on this podcast because I am actually the non-woke endocrinologist. I do everything different than the current endocrinologist. 98% of the endocrinologists just look at one blood test called the TSH, and they don't even listen to a patient's symptoms. And right away that if the TSH is normal, they kick you out of the office and say you're nuts or you're hypochondriac. And these are people who really have serious physical issues, and it really interferes with the person's quality of life significantly. So that's why we don't want to kick these people out and we want to treat them. But the whole key is that you've got to listen to the patient's symptoms. The symptoms are the key. Now, I learned this in the 1960s when I was in medical school, because that was before the days of blood tests and the synthetic thyroid medicine. And since the 1920s, that patients who had thyroid disease, which in those days it wasn't very subtle, they had these big goiters sticking out their neck. I mean, you couldn't miss it. And so what was done in those days, they treated people either with plants or with organs from animals. So anyway, like if a guy was having problems in the bedroom, they would treat him with pig's testicles or something. And well, that didn't work too good. But somebody tried to use the thyroid glands of pigs, and that worked perfectly. And so they gave these people this awful tasting thyroid from pigs, and the big swollen goiters went away. So big therapeutic success. And so the biggest meat packing company in those days was Armour Meatpacking. And so now they call Armour thyroid is the thyroid that's natural thyroid that's made from the pig thyroid glands. So anyway, so Armour thyroid was the only treatment from the 1920s to the 1970s. And it worked like a charm because it was very simple. There was no blood test. And although we didn't understand about the physiology or the molecular biology of the thyroid as we do today, that it was pretty simple, common sense, that you talk to a patient and found out, well, they have all the typical symptoms of an underactive thyroid. They're tired, they're depressed, they're gaining weight without changing their diet, they have brain fog, they have low motivation, they feel pretty awful, right? So you say, well, all these symptoms, you look up the medical book, fatigue, weight gain, oh, must be low thyroid. So you listen to the symptoms and you treat them accordingly to the symptoms. And, you start them out with a little bit of Arbor thyroid because that was the only medicine. And then, every couple of weeks you increase the dosage a little bit until the patient felt better. I mean, and that's you stated that dosage. So it was not brain science. But it turns out, as we really understand the depths of molecular biology of the thyroid, that the blood tests really have little to do with the actual function of the thyroid, its normal function. Because the blood tests, especially the TSH level, that 40% of people who have low thyroid have normal TSH levels. But if that's the only test that a doctor looks at, he's going to miss the diagnosis, right? So what actually means is there's this other thyroid hormone called T3 that goes from the bloodstream, and it's made from T4, which a weak thyroid hormone gets converted to T3, which T3 gets into the cells, and T3 is actually the fuel that gives the cells of the body energy to function properly. So, like an example of this would be like your thyroid gland controls your metabolism. So if your thyroid is low, you gain weight without eating more food, right? So it's very frustrating. So what happens is the T3 gets in the cells and gives the cells energy to burn calories. And then that, of course, helps people lose weight, have more energy, and thyroid controls the function of every cell in the body. So you get like 200 different symptoms of a low thyroid, from anything to hair loss to called brain fog to gaining weight, and also you can get certain things like loss of sex drive, one of the causes of it, and there's like 200 different symptoms. So you have to listen to the patient carefully, just in case the blood tests aren't indicative or show anything. But the most problem is that if the doctors do the right blood test and they know how to read the blood test, that the blood tests really do correlate with thyroid underfunction. And you see, like Ellen was talking about, like the normal range. Well, you know, um, when laboratory tests came out, they had to be very scientific, and they formed what was a normal range, and that was a low number to a high number. And so doctors and everybody else, and they still do, think normal means that if you're in the range, you're normal, but it doesn't mean that at all. Norm is a statistical term for a type of average. So when you are given a blood test result, and it's called, now they changed it to the reference range from the normal range, because now they realize that it is confusing. But still, everybody, especially nowadays, patients can go on the laboratory portal and look at their blood tests and say, oh, I'm normal because my blood test looks in the normal range, or there's something wrong with me, doc. I'm hyperthyroid because my blood level of T3 is, 0.2 of a point above the top of the range, which is not that at all. I mean, and you can be abnormal by having very low levels of thyroid hormone in the lower end of the range, but still be in the range. Or you can be at the top of the end and not be hyper. So, and then we'll talk a little bit more when we talk about libido and testosterone hormone, which is the other part of it. So this is where we are. So I'm the iconoclast, the non-work doctor that, that you go to 98% of the endocrinologists and they say, oh, Melnick's nuts. He uses this old-fashioned thyroid medication, and it's not even approved by the FDA. So is it approved by the FDA? Well, is it sold in drugstores? Yes. So, but it's not approved by the FDA because it never had to go under the testing that new drugs have to go through, because it has 75 years of very effective and low complication rates. So they didn't have to retest it. So yeah, but some PR person from the drug companies who make the synthetics said, oh, it's not, FDA approved, but it is certainly approved if you can buy it in the drugstore. So anyway, and this drug works much better than the synthetic hormone, the synthetic like Synthroid. And what's really scary is Synthroid throughout the world is one of the most heavily prescribed drugs. Because, thyroid affects, I would say, 35 to 50% of women, and only 10% of men. It's not because they don't have it, but men never go to the doctor and never get tested. So, but I mean, like I have a thyroid condition. Everybody in my family does. I've been on thyroid medicine for like 40 years. And I know that if I miss a dose, like I'm asleep 2 hours later. And I said, oh, I forgot my thyroid medicine. But, everybody in my family has, including like I have a, well, he's 8 now, but when he was 5, he was really acting out in school. And luckily his parents took him to a doctor who checked just the TSH, and it was very elevated, indicating he had low thyroid problem, and that was the basis of his acting out. And so the thyroid is really important, and you got to do the right blood test, and you got to listen to the patients, and you got to use the natural thyroid hormone because like again, 60% of people who are treated with a synthetic medicine don't feel good. Now, of course, they just look at the TSH level. And so, someone walks in and said, Doc, I didn't, I don't feel any better on the medicine. I'm still tired and, my brain fog, my hair is falling off and I'm gaining tons of weight. And the doctor looks, well, your TSH is normal. You're fine. You're just eating too much. You know, you're just a couch potato. Get the hell out of here. That's basically what happens. And it's because the doctors don't understand the role of T3 as being the most important thyroid hormone. That's one. And so they don't test the T3 levels. And that's a tip off. And the other one is, a lot of thyroid disease is autoimmune. In other words, when the body incorrectly attacks its own normal, healthy tissue as if it were a foreign invader like a bacteria or virus. And that kills off thyroid cells and makes people underactive thyroid. And this is probably one of the most common causes of hypothyroidism. The armor thyroid has T3 in it already. So if someone taking T4 doesn't make enough T3, then this medicine will be much better for them. So those are major thing about thyroid. Now when do thyroid problems occur? Well, most commonly it starts after a woman has a baby, or it occurs or gets worse during menopause. And menopause really starts about 10 years before you think it does, because it's not when a woman stops her period, but it's really the 10 years before where the ovaries are starting to close down and there's, wild hormone fluctuations. So that's where a lot of the symptoms, the unpleasant symptoms occur. And after the period stops, well, usually the hot flushes stop, but all the psychological and emotional and sexual disturbances, just sort of fade away. Not necessarily get better, but they just don't get worse. Uh, yeah. So unless it's treated. So so that's pretty much about the iconoclasm of hypothyroidism, and definitely I am against the grain of 98% of endocrinologists, and yeah, I mean it's fine. I was in the hospital. It was a very good hospital. That's where I did my training many years ago, and I was as a patient in the hospital, and so they saw I was on Armour Thyroid, and they sent in the chief of the endocrinology department, and he was trying to convince me why I shouldn't take Armour Thyroid. Here I am, like 3 sheets to the wind, half asleep, with 105 temperature, and I wasn't in the mood to discuss it with him nevertheless. But that's the whole mentality.
No, absolutely. And Dr. Melnick, for the scores of people that you've helped, we know you're not nuts. We know that you get it. You
Uh,
understand us. You helped
yeah.
us. When I first came to you, I was in my late 40s. I had just had my second child. I was irritable. I was gaining weight. I had brain fog. And it was, my kids called me the screaming banshee. And I would go to the doctor and, well, you got to exercise more, you got to eat less, you're just getting old. And you have a thyroid problem, but we'll give you uh, Synthroid, which didn't work. And I looked up, I think it was the Stop the Thyroid Madness website,
Mhm.
and found you. And I did, before I got you, found you, I was able to convince my doctor to at least try me on Armor Thyroid. At, but what they did was they gave me 15,
Ah,
15 grams and said,
well,
well, that's it.
that's it. That's what's usually they treat babies with. Seriously, for adults usually need about 180 to 360 milligrams a day, but you don't start at the dosage. You start out maybe 60, but at 50, there's no chance of success.
No, and they just didn't get it. But
Yeah.
I knew that there had to be another answer. I
Mhm.
knew that I had I was empowered enough to seek help somewhere else, and the rest. I feel wonderful now. It's a combination of not just thyroid, and we'll get into it in a minute, but other hormone imbalances. Now, as I'm now 61, having gone through all of the changes and menopause and everything else, it's just so important and to really ensure that all of the hormones are working properly. And that's one of the things that we talk, that you mentioned, the lack of libido, the underactive thyroid, as well as your libido being low. So can you talk a little bit about the connection there?
Yes, absolutely, absolutely. So let's go to the basic, biology of what menopause is. So what happens is, a woman starts getting her period about 11, 12, 13, and when they get their period, that means a woman is ready to produce eggs and on a monthly basis gets her period, can get pregnant. But usually around 35, that the ovaries start slowing down and the egg quality is not so good, and very few women, get pregnant in their early 40s or thereafter. And what happens is the ovaries produce two hormones. The one everybody knows about is estrogen, the female hormone, obviously. And, the female hormone during the 10 years before the period stop, it fluctuates wildly, goes up and down, up and down. And that's what makes women crazy, that this, it gives them terrible anxiety, terrible mood swings, makes them cry at things that they never would cry at, and makes them scream at somebody that ordinarily they would just totally not be affected by. So that's, this is the hormone fluctuation. So, but what's really happening is the other hormone is testosterone. And testosterone, believe it or not, women do have testosterone. And testosterone is really important for a woman's health. And, and once they go through the menopause and period stop, they make very little testosterone. And that's not good for a woman's health. And we'll talk about that a little bit, other detailed problems. But the main thing is that a woman's testosterone causes the bones to stay firm and keep calcium in it. And when the testosterone is low, women get typically 100% will get osteopenia, then progresses to osteoporosis. And again, the earlier a woman stops menstruating, the more deterioration of their bones, and the younger they're the problem. And when you have thin bones, that's why so many people, as they get older, fall over and crack their hip. And of course, once there's a fracture of the hip, a certain percentage of people just never recover. Within 6 months, they're gone, even though they go through the surgery and everything. Not everybody, but it's a very serious thing. So that's why we want to prevent the bone loss. And the bone density scans are the best things we have to detect it. So you really need testosterone to keep the bones strong. And of course, what happens is that a lot of women notice, even though they work out, their muscles become flabby, and or especially if they don't work out. And so, this is a condition called sarcopenia, and of course, this is related to testosterone, and testosterone can build up the muscles and builds up the bone. Um, and again, it's very important. Um, So testosterone is really something that women should consider even before their period stops. And the whole thing is, there's no blood test for testosterone. There's a blood test, but I'll explain how it works and how it doesn't work. But and testosterone determines sex drive, and so I would say 90 to 95% of the women, when they hit their middle to late 40s and get stopped, and after the menopause, that they really lose their interest in sex, no matter how sexual they were beforehand. And they say, oh yeah, well, we're getting older, ha ha ha. But nobody's really happy about it, but that's what we're taught to accept. But it's really due to a loss of testosterone. But the big problem in diagnosing this is not knowing the fact that the symptoms, just like the thyroid, are the key to the whole thing. And blood tests are not the key. So if you test thousands, I've tested thousands of women, looked at testosterone levels, and most of them, if the level is somewhere between 5 and 45, most everybody's in a range of like 20. Okay. So most of the time the woman sees her gynecologist and says, I'm just not into it anymore. Check my hormones. So he checks the testosterone. They said, listen, your testosterone is fine. It's right in the middle of the range. But again, the blood test, there's many more complicated factors than the amount of testosterone in the blood. So when you look at a detailed thing, that in my experience, like I find quite a few women and men, even though their testosterone is the lower end of the range, they're very sexual, and it all works very well. Um, but a lot of times when they're the lower end of the range, you're more likely to find that there's sexual dysfunction, painful intercourse, loss of interest, and all that. And then there's some people who have very high levels of testosterone that have really very little interest in sex. And, there's a condition called polycystic ovaries, which in the true sense, women have higher levels of testosterone. And I've never seen a woman with polycystic ovaries that had a high sex drive, no matter what age, even though they have high testosterone, because you can't look at a blood test. I mean, the blood test may help you figure out the starting dose of the testosterone, but testosterone is really key for both men and women. And I'll tell you this right away, that for both men and women, because and it's the falling testosterone levels has a lot to do the way a person ages. I mean, your muscles, your joints, your bones, and it affects your brain. That low thyroid causes brain fog, but also low testosterone does, and low testosterone causes low motivation. And that's why a lot of guys just are happy to sit in front of the TV, and watch soap operas or something. I don't think but something like that, that they don't have
Yeah.
the testosterone. But again, and like testosterone given properly, not like for the weightlifters. You don't get roid rage or anything. You don't punch anybody out if they look at you the wrong way. Uh, but it really gives people a lot of energy. And it really, like when you go through the menopause and men go through this andropause, uh, the testosterone and the thyroid work together. And it's logical that it energizes people. So, so the big problem with couple big problems um, with hormone replacement therapy, both estrogen and testosterone. Number one is there's a huge myth that estrogen, the female hormone, causes breast cancer, okay, which is not at all true. And this thing started in the early 2000s. There was this large study called the Women's Health Initiative. They had like 10,000 women, and they were comparing women who took hormones and women who didn't. And they stopped the study because the women who took hormones had a much higher uh, breast cancer rate than the women who didn't. So they stopped the study. But 10 years later, they looked at the data again, and they found out that the progesterone they were using for the women who were on hormone was a synthetic, and that was the factor that was causing breast cancer. It was not. It was not the estrogen. And in fact, the group that just took estrogen alone had a lower incidence of breast cancer. So that's one issue. Number two is that there are certain types of breast cancer that are called estrogen receptors positive. And if they're estrogen receptor positive, then estrogen makes the tumors grow. So part of the treatment is to stop a woman's estrogen, and um, and that doesn't make her feel very good. But the alternative is having cancer that gets less than optimal treatment. So, but estrogen doesn't cause breast cancer. But in certain women with breast cancer, you can't give them estrogen. Okay,
Got it.
so that's the key. Now, testosterone and cancer. Well, testosterone doesn't cause cancer. In fact, in women, studies show that women who take testosterone and estrogen have a lower incidence of breast cancer than women who take no hormones at all. So, and again, testosterone is something that works against breast cancer, and it works against abnormal breast tissue development. Like some women have this thing called fibrocystic breast disease, when their breasts are very tender and everything, and then when they go for a mammogram, they can't see everything because the breasts are too dense. Well, women who take testosterone, the fibrocystic component of the breast goes away. And there are some women that in the past I've had to treat with testosterone, not for libido, but for breast tenderness and breast pain. Or some women who just say, I'm just sick of getting 20 mammograms a year, and so we get rid of the fibrocystic breast disease, then they can have their breast mammograms with more accuracy too. So testosterone is really good. And there are studies showing that testosterone is very important in reducing um, cognitive problems like Alzheimer's, and and also lowers the incidence of heart disease in women. And heart disease in women is a real killer. It's worse than men when women get it. It's much more quickly fatal and harder to recognize because women don't have very much symptoms before that. So testosterone really protects the heart. And the only thing that is controversial in men that whether testosterone does make the prostate grow, and but whether it causes prostate cancer, most people think it does not. And but again, a man who goes for testosterone treatment should be checked for prostate cancer anyway. And but that's the only thing you have to watch out. Women don't have to worry about that. So the big problem with testosterone is how to give it so that it works without giving a woman side effect. And the side effects with testosterone for women is acne and facial hair, some excess hair on the body, and very rarely do you see male pattern baldness. It's mostly uh, diffuse thinning, just like thyroid. So with this kind of thing, that this happens when you can't give testosterone orally because it can have a negative effect on the liver, but you can give it by skin absorption or through the vagina, but it doesn't get well absorbed. And you can't, testosterone injections will absolutely are so strong for a woman that they'll get side effects without it. And the best way to do this is the bioidentical, which is means exactly hormones like your body makes, testosterone with the same molecular configuration as as the testosterone that's made in the ovaries and the testicles, and it's in a pellet form that is put under the skin with a little local anesthetic. It takes about 10 minutes for women. It takes more for men because men's dosage is much higher. But you have a little sore butt for a couple days if you sit down on the wrong spot. But it's very negligible, if anything, and it's very safe. It has less than 1% complication rate being infection or extrusion of the pellets. And the pellets for women last about 3 months, and women's dosage goes from like 100 milligrams to 200, but most somewhere 125 to 137. But men, minimum of 800 up to 2200. So because we need more testosterone than you ladies, and so the testosterone is the best way to give. Well, it's important to take, and the pellets are the best and safest way because there's very little side effects. Because like when you take a shot, the level goes very high, and drops down, up and down. And that's when you get the side effects. But if you have a low, steady flow of testosterone, you don't get side effects. So that's the whole thing. So testosterone is really important. Again, I'm the non-woke endocrinologist because I give testosterone to as many women who, would like to take it and who it's indicated in. Um, and whereas I think 95% of the gynecologists are unaware of testosterone and its role in treatment. And unfortunately, um, I would say 95% of the oncologists who treat breast cancer don't know about the role of testosterone in treatment of breast cancer. Because as early as the 1940s, uh, that when women had metastatic breast cancer, this is before all these immune therapy and everything that they're doing studies with, uh, that they were using testosterone for regression of metastatic breast cancer. And what they found is that the women felt a lot better, because they were recovering from cancer, but it gave them much more vitality, energy, got rid of the depression, and they felt much better. And again, those days they didn't keep survival statistics, but I know that it's better. I mean, uh, I don't deal with breast cancer very much, but in this case, she was young, 35-year-old gal came to see me, I'd say about June, and she was diagnosed with stage 4 breast cancer, and she had like a 5 centimeter mass, which is like the size of a cantaloupe in her breast, and
Mm.
so they they bombed her out with chemotherapy and knocked her estrogen levels down and made her feel awful, and we talked about testosterone in addition, and they wouldn't give it to her at Sloan Kettering, because that would screw up their studies. You can't have another variable. But I tell you, between starting that therapy in the end of June and I would say 3 months later, the mass was gone and her PET scans were normal. Now, this is a case of one, but I
Right.
mean, it's really dramatic, and it can work. And plus, the fact she felt great. When you give women medicine to knock her estrogen out, people feel worse than feeling menopause. It's like the worst set of hot flushes, but it's also depression and low energy, and chemo is not a good thing, and especially when it affects the hormones. So therefore, testosterone is very important in, before, and during and after menopause in women. And for men, it really changes, a man's vitality, his motivation, and it's not only for the bedroom, but it's. I mean, I've been using it for about 4 years now. I'm 78, and I feel a lot better. I started taking it when my wife passed away, and I went down, like, I'm 6'2". I went down to 135 pounds, and I was just not eating, not doing anything. And within 6, 8 months, I was back up, to my usual 165, 170 pounds, and I could work, and I, had focus again. And it's really important. I'll still take it because I don't want to be without my testosterone. So, so yeah, and so those are the major things. So it pays to find a doctor who's a bit of an iconoclast, who's definitely non-woke. Because and again, let me be critical of the hospital system, because
Please.
first of all, everything is done by protocol. And the protocols are all designed to limit liability, number one. Number two is to get research grants. And that means with research grants, they have to treat patients in a similar way, everybody the same way to get the data. So those things do not allow for free expression or creative thinking or new concepts of treatment. But it's kind of, statistically you get uh, decent cure rates, and you get very low malpractice suits. Okay, so unfortunately, that's the way the trend is, because there are not going to be very many doctors in private practice in the next 25 years. that all the doctors will be working for the major hospital centers. And
I
I mean,
hope, I,
and yeah, I know
I,
you're saying, I know
I
you're
hope
saying,
not. I hope
yeah,
not, doctor.
yeah. But I think, well, just to be, honest about it, I think
Yeah.
that there goes the doctor-patient relationship out the window when this is. But on the other hand, look, they have all your medical records. You know, you get very timely care, and the care, by standard is not bad. It's not creative, but it's the tried and true stuff that works, which will cure a significant number of people, which is what it can be done. So 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 if you're out there, look for some doctors who think on their own, think out of the box, but not too crazy.
No, I think, doctor, you provided the ability for people to realize that we don't have to suffer with aging issues or with menopausal issues, to
Mhm.
just to find a doctor who will look at the clinical, not just the blood test results,
Right,
and not do the check
absolutely.
the box.
Right,
Yeah.
absolutely. That's the whole thing, and unfortunately, that is not encouraged in today's medical society. It just doesn't work for mass care.
But I'm glad that you were there for us, and you'll be retiring on effective May 1st, and we will
May first,
definitely
yes, yes, I know.
we'll we'll definitely miss you, and
Oh, thank you.
I don't think there's words to express the how you have helped all of us, doctor.
Oh, oh, thank you. Well, it's been 48 great years that passed all too quickly, but there's time to change around a little bit and spend a little time for myself these days.
Absolutely, and you don't look like you're 78,
Oh, thank
and
you.
and
Well, I
I
guess I'll come back with the next invitation then.
and I, speaking from experience for the audience, I will say I get pellets every 4 months. That's what works for me, and it is a painless process. Yeah, it's a little tender on your butt for about a week, but I bought a pillow from the My Pillow guy, believe it or
Oh,
not,
no, no,
and
I wouldn't admit that to anybody.
it's a nice little pillow. It helps, but that's I thank you, Dr. Melnick, for taking the time, making the time to really let people know that you don't just your health is really important, and you're the only one who knows what your symptoms are. And if you find a doctor like Dr. Melnick that you can communicate your symptoms to, and that will listen to you and is on the cutting edge. I mean, doctor, you're always ahead of the game. You're always looking for, as you mentioned, the pellets. It's just it's important that people take control for themselves.
Absolutely. Well, thank you so much for having me. It's been a lot of fun.
Absolutely, doctor. Thank you. That's it for this episode of the Non-Woke Coach podcast. Thanks for tuning in. Please follow the show on your favorite podcast listening platform so you don't miss the next episode. While you're at it, please sign up to our email list at linktree/non-woke-coach, where you can also download free success resources and learn more about my private coaching packages. I'm Ellen McCarthy, the Non-Woke Coach, and until next time, keep embracing your true successful nature.